I'm Javier Rodriguez, and I'm the President and CEO of DaVita Kidney Care. The future of nephrology is really, really exciting. If you look at the transformation that we've done from the origins of, number one, getting out of the hospital into a very efficient model of care. Number two, transforming from a fee-for-service to a bundle. And now, number three, sort of the next frontier, where we're going for holistic care, where we're going to shift from a treatment base to a patient base. And so one of the most exciting things that we have happening in our community is that we are going to be involved in the whole transition of care, the point where the patients are quite vulnerable and frustrated with how it's happening today. Well, an ESCO is, for those that are not familiar with the term, is basically a word that's being used in ACO in kidney care. It's a pilot in which CMS and CMMI are trying to say, can you go full capitation? Can you take risk the entire continuum, not only what's going on in the treatment, but the entire thing? And while imperfect, we are just so happy that CMMI picked nephrology as a place to experiment and to innovate, because we think we are the right place, because our patients are quite ill. They have many scripts, many subspecialists, and are hospitalized almost 2 times a year per. And when you have a population that's that ill and spends 12 hours a week getting care, we should be able to do a lot more with them and help them to both enhance their life, their quality of life, and number two, reduce the cost. Well, the nephrologist is obviously the quarterback of the whole thing. You can't have anything happen without the nephrologist leading. And so we're working with our nephrology practices. We're working to make sure that they feel that we've given them the tools, both from a technology perspective, from a protocol perspective, from a support perspective with our nurses, our technicians, and all our support in our centers, so that they can do their job in coordinating this care. Well, I don't think I need to point anything to them, because they know it better than I do. They're taking care of patients every day. We know that there's a high degree of difficulty. We're not naive to that. We know that these problems that we have in our healthcare system are macro challenges that we all have to face. But we're really excited with the partnership, the transparency, the innovation, the energy that everyone's bringing to it. And if you were to say, pick a subspecialty in which holistic care can work, I'm betting on nephrology.